Hello and welcome to your Checkoff 2 video. First, we already have our PPE on, which is our bonnet, our mask, our eyewear. We have also opened all of our sterile items. We have done our 3-minute scrub. We have gowned and gloved. So now we're going to start with the second portion of your second checkoff. The first thing you're going to do is drape your mayo stand. So you want to unfold the mayo stand on your back table. You can move things if you need to make it flat. You put your hands into the flaps and you're going to open up the mayo stand cover to introduce it to your mayo stand. Keeping your hands inside the pocket, you're going to put one of your feet on the rungs of the mayo stand and slowly guide the mayo stand cover onto the mayo stand. You want to be careful to not let this front part drop, so we keep it close to our abdomen to not let that front part drop down. And we just shimmy it all the way on. Now, depending on where you are going to pull up or what side of the patient you're going to be on will depend on your setup. We're going to take 2 towels and place them on the mayo stand. And most of your instructors have taught you to tuck this in. Notice how I'm not turning my back to the sterile field as I'm doing this. I'm using my mayo stand and turning my mayo stand. As I pull things out of the basin, I'm going to place them where they go. So the neutral zone I know is going to go onto my mayo stand. We have our kidney basin, our lap sponges, and our Raytex, our needle book, our Bovie, our suction, our light handles, our skin pen, and now I'm going to organize the rest of the things in the basin. We have our specimen cup, our med cup, our yank hour suction tip, our labels, a ruler. We have our round basin. I'm not going to use our trash bag, so I'm just going to place that underneath our big basin. I'm going to grab everything out of our basin that we opened, our peel packed items, and place them next to our countables, and put our drapes inside our basin. A laparotomy drape, you're going to want a 3/4 sheet or a down sheet, and then your 4 towels in your ring stand. Next, I'm going to make a roll towel. So in order to make a roll towel, I just open my towel halfway, I fold it again, and then that's how I'm going to make my roll towel. I'm going to fold the corners in, roll it away from me first, flip it over, put my palms on the roll, and I'm bracing the table so the table doesn't slide towards me with my leg, which you can't see right now. But you want a nice sturdy roll towel, and that'll prevent your instruments from falling over. So once I have my roll towel the way that I want it, I'm going to leave it right there. I have my count sheets, my stringer of instruments, and I just take the stringer and put it right underneath my instrument sheet. I have my knife handles. And then I'm just going to organize everything else that's in the pan. So I have my pickups that I will organize, my retractors, and you want to place them in such a way that they're very easy to count. You can see clearly the instrument that you're trying to count, you and your circulator. So set them up nice and neat. And now we are ready to accept medications. Now I'm going to accept medications and solutions onto the back table. One trick that I like to give students is to keep your hand on your back table at all times while accepting the medication so you don't completely turn your back to the sterile field. I'm ready for my normal saline, please.
Okay, I have 0.9 sodium chloride irrigation. Expiration is October 2023.
0.9% sodium chloride irrigation, October of 2023. Thank you. Now I'm going to make a label. As soon as you receive anything on your back table, medication or solution wise, you need to make a label for it right away. And I'm filling up my asepto. In order to do that, you flip it upside down, get all the air out, and go right back in. And fill that completely up. Once that's completely filled up, you're also going to label the asepto. And you want to make sure that you put the sticker at the top so that the sticker doesn't come off while it's sitting inside your fluid. Okay, I'm ready for my local.
And bupivacaine, 0.25%. Expiration is 04/2023.
I have 0.25% bupivacaine, and expiration date is April of 2023. Thank you. Again, I'm going to label this as soon as I receive it onto my back table. I'm also going to prepare my local. So I'm going to take my 10 cc syringe. I'm going to draw up 10 cc's. I'm going to make sure that I don't have any bubbles. I draw up just a little bit past the 10 cc's in case I need to expel any bubbles. And then I will put my hypo on and also label my syringe. When you put your label on, be careful not to put it over the numbers, as we don't want to cover those up so we can keep track of how much local we're using. And I'm going to lay that right next to my knife handles. What I'm going to start with is our Ratex. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Laparotomy sponges, I have 1, 2, 3, 4, 5. Peanuts, I have 1, 2, 3, 4, 5. I'm going to start counting my sharps. Suture needles, I have 1, 2, 3. Blades, I have 1. Hypos, I have 1, 2. Bowie tip, I have 1. Now I'm going to start with my instrumentation. I'm going to start with knife handles. Number 3 knife handles, I have 1, 2, and I have 1 number 7 knife handle. Forceps? Yes. Forceps, I have 1 dressing forceps. I have 1, 2 DeBakey forceps. I have 1 Ferris Smith, 1 rat tooth, and 1, 2 Adson with teeth. Retractors, I have 1, 2 Army Navy. I have 1 2 Richardson Eastman, 1 small, 1 large, 1 malleable retractor, 1 small Wheatlander, 1 large Wheatlander. Okay. Stringer, curved mosquitoes, I have 1 2 3 4. Straight mosquitoes, I have 1 2 3 4. Curved hemostats, 1 2 3 4. Straight hemostats, 1 2. Curved Kelly, 1 2 3 4. Abs and tonsil, 1. Alice, 1 2. Babcock, 1 2. Coker, 1 2 3 4. Forrester Ring, 1. I have 1 Cryowood, 1 Mayo Hagar, 1 Webster, 1 Lister bandage scissor, 1 straight Mayo, 1 curved Mayo, 1 curved Metzenbaum, and 1 2 3 4 perforating towel clamps. Correct. You're going to angle it on your needle driver. You're going to choke up on your handle, and that's going to give you more control. I like to use my middle finger of the hand that's holding the handle to guide the needle driver and guide the blade right onto the handle. Okay? Once you have it on, you can place that into your blade protector, and then in order to take it off properly, same thing, make sure that you're choked up on your handle, but you're going to come down to the edge of the blade, lift up slightly, and use your thumb to push the blade off. Then place your blade into the styrofoam part and place your handle back down. Now we're going to go to suture. As you guys watch the video, you're going to grab your suture and you're going to come at it with your needle driver. You're going to turn your suture about a 45-degree angle. Don't come straight down on it. And you're going to want to come about 2/3 of the way from the needle tip or 1/3 of the way from the swage of the needle. So just like this. And when you pull it out, should give you the nice 45-degree angle. Okay? And you can just place that right back onto your suture packet and onto your table or roll towel if you have enough room. And then when you're passing it, make sure that you're passing it with a needle towards the surgeon's nose.